Welcome to the Doctor Connect, where we are connecting through inspiring stories and providing education and information around wellness, health, cancer, and medical technology. I'm your host, Dr. Ludmila Schaefer, medical oncologist, broadcasting from Kansas City in the United States. All information discussed on this platform does not substitute your medical care. All guests on this platform sharing own stories, experiences, and conclusions. And thank you very much for joining us today. We have a very special guest today. And as we all know that it is approaching the 20th anniversary of 20 years post 9/11, it is very important to acknowledge all responders and everyone who has been at the difficult time. So the health problems post September 11, 2001 really created a lot of individual challenges. And today broadcast related to not only 9/11, we do want to acknowledge, but most important, we would like to learn the very unique experiences of our guests about plastic cosmetics, about mindfulness, about mindset, power, and also we will hear survivors of cancer stories. So with that, thank you very much for joining. And I would like to invite our very special guest, and Michele Garber. Michele, welcome, welcome, welcome. Thank you very much for joining.
Thank you so much for having me. I'm very excited to be here.
Yes, it is a very special, very difficult week. And I was just discussing with our viewers that we need to acknowledge, and we all understand that we're not responders. I'm not a responder, but I do truly know that a lot of people have been affected by health. And we do know that World Trade Center health program play a big role. And with that, we do know that we have a different experiences and conclusions. But the most important, I also would like to know, with everything that we do around plastic surgery, cosmetic surgery, it's for beauty, but it also for other reasons. For reasons of reconstruction after cancer, every single person has a different story. So
Yes.
with that, I would like to ask you, Michele, please tell us your full name, where you're located, and a little bit of your backstory.
Thank you. My name is Michele Garber, and I am a plastic surgery coach, patient advocate. I also work in functional nutrition with my clients. And I'm currently in wine country in Sonoma, California. I'm originally an East Coast gal. I can always say you can take the East Coast out of the gal, but you can't take the East Coast. You can take the East Coast. You can move out of the East Coast, but you can't take the East Coast out of the person. That's, I think, what I'm trying to say. It came out a little wrong.
Thank you.
Yeah. And speaking of 9/11, I was on the East Coast during the 9/11 attacks. And so it did hit me very closely. And it was, there was a time that was really difficult to work at that time. And that particular time, I was not working as a plastic surgery coach. I was actually working as a publicist. And I found it very difficult to work during that time because it was, everyone's mood was just very somber. Yes.
It was affected a lot of lives. I was a couple of years into, I was arriving, I'm in the States for over 20 years, but it was one of those transition times. And it happened to be that I was here and I could feel I was more in Arizona, in that area, visiting at that time. And we all felt so difficult. It was very, very difficult morning. And with 20th anniversary, we know that the number of victims of cancer victims and also people who was just nearby ground zero, not even responders, but who just lived there, work, or maybe went to school near the World Trade Center. Now, actually, the numbers rising, and it's a lot of different issues we see. So thank you so much for acknowledging this. Now,
Yes.
I would like to go to our roots of our conversation, and I would like to hear about what is your backstory? How did you decide to do what you do? Tell us a little bit of your experience and how we can learn from you.
Thank you. Well, my backstory is I've been in the world of beauty, let's say, for about 25 years. And I was working as a publicist on the East Coast at the time. And then I moved to California. And I was working with plastic surgeons and dermatologists, and I was working with patients. I was also behind the skincare scene, working with different manufacturers and private label. And I was in 2012, I decided that it was time that I have a little work done. And being and having a background that I had, I thought, oh, this is going to be easy. It's going to be easy to choose a plastic surgeon. I know what I know. I don't need a lot of information. And so I just dove into it, chose a surgeon based on someone else's referral, and really found that my decision-making was a little bit off. I did not have a good recovery. I did not have a lot of support. I went down some rabbit holes. I also had some depression involved. And there were things that didn't go the way that I thought they should go. And I found myself just kind of dangling and going down this dark rabbit hole. And it was during this time that I decided that, there is no one out there who is really supporting patients from the patient's point of view. There's no one out there that's supporting. What about, how do you choose a doctor? I mean, I made some mistakes along the way of choosing a doctor. So the Nip Tuck Coach was really born out of my own experience and what I felt passionate about, and where I felt that there was a gap between patient communications and surgical practices. And so my mission and my goal is to really help people navigate through the confusing world of cosmetic surgery and procedures, looking at it from a holistic viewpoint. It's not just, I'm going to have some surgery, I'll choose a doctor, we'll go that day, I'll show up. It's a lot more than that. And so I like the mind, the body connection, the nutrition connection, and it's evolved over the years. And I'm very proud and very passionate what I do because I see the outcomes, and I also see and take people through the journey. So I have the opportunity to share with them their ups and their downs and their excitements and talk them off of ledges, so to speak, not literally ledges, when they're really anxious, and be there for their support system, giving them unbiased information, straight talk. And I'm very upfront with my clients. If they're thinking about doing something, and I'm not a medical doctor, but we talk it through, and their aesthetic goals, it's very important. But sometimes people have one idea or one mindset of how things should go, but that's not the reality. And
Yes.
so it's really important to be there and give that support to my clients so that they know the reality of the surgery, because it's surgery, it's medical, it's really a life or death situation.
Right. Thank you, Michelle, for mentioning this, because what I was just thinking as you were describing on several points, and I would like sort of step back and discuss them. Number one, not a lot of people actually comfortable to go and stand in front of TV and go and tell, oh, I had a plastic surgery and that's what it is. Right now we kind of not very sure, if I would have, I'm not sure if I want to go and tell everybody. Plus, in 1990, before 1990, plastic surgery was not that developed, and then it started actually rising here, so fast. And I looked after 9/11, it kind of dropped, but then again start rising. So one is that confidence actually to come and look for help and search for help. And that's, I understand, where your expertise comes. Is that correct?
Yes, I think, well, things have really changed. When I started my business back in 2012, plastic surgery was still, not as common. I mean, a lot of people were doing it, but people didn't want to talk about it. Botox and fillers was popular, but still people were a little bit shy about talking about it. And they really didn't even understand the difference between Botox and fillers. And I remember having these conversations with people. And so things have definitely evolved where it's affordable to a lot of people. There's many different ways you can finance it. And also it's really come more mainstream, I think, especially since COVID. COVID has really created what a lot of people are saying is a Zoom boom in plastic surgery, and then a post-pandemic Zoom boom, because the
It's
world has
technology.
shrunk.
Yeah, I've
Yeah.
never heard of that.
Yes,
Yeah.
the Zoom boom.
Zoom boom.
Yeah, Zoom boom. Because look, let's face it, when COVID hit, everyone was indoors, couldn't do anything, right? And people were on Zoom and they were looking at themselves and starting to really focus on what they were seeing and what they didn't like. And so it's really gave people the opportunity to think about, well, I don't know, do I need a little bit of a tweak here and there? I don't like my jawline. I don't like my nose. I don't like my profile. I don't like my eyes. And so, but that in itself is not always healthy. So, it's not always the best thing to do is hyper focus on a body part, because you run the risk of really getting into body dysmorphic disorder. And that is when someone looks at themselves so closely that it affects their daily life, and they start to really focus on a body part that they feel they need to fix. And there may not be anything wrong with that body part, but to them, there is. So there's a fine line between a disorder that is extreme to, I just want to look refreshed. I just want to change a little bit so that I look as young as I feel, in a healthy way.
In a healthy and a genuine way.
Yes, in a healthy way.
In a healthy way. And that's the reason, Michele, that I wanted for you to be on our show, because I believe I don't work in plastic surgery. I'm a medical oncologist, and we have a very close relationship with patients. So we obviously go through life, we hold in hands and have communication. So it's ongoing. But also, because I have a JRL experience, overall, the surgeons, they are doer. And so it's basically, it's done. It's not like we hold in hand for a long period of time. And where you come in, it's like an advocate. I understand that you are discussing about nutrition, what they understand in the communication, the terminology. So you basically like a main advocate. Is that correct? Sort of long-term advocate?
Yes, I'm a patient advocate in the respect that if a patient is having a communication problem with the surgeon, or the patient needs something, well, I'll give you a perfect example. I'm currently working with a young woman who is scheduled for surgery next week, and she really needed to speak to the surgeon prior to seeing him the day of surgery. And she's been calling the office, and she just hasn't been able to get the time that she needs with the surgeon. So as a patient advocate in that respect, I'm able to contact the practice, get her in to see the surgeon. Well, in this case, it was just a FaceTime. But the point is that I advocated for her that she really needed to speak to the surgeon prior to surgery. and she was not having any success doing it on her own.
Mhm.
So that's
Sorry, so you just picked up the phone, or do you know the surgeon, or you just picked
well,
up the phone and called the office?
yes, because
That's
she is my client, so I'm working with her. I've worked with her from the moment that she thought about having a facelift.
Mhm.
So we chose I was the one that referred the surgeon to her. So I have a relationship with that surgical
Mhm.
practice. And sometimes, because I do have a relationship with the surgical practice, I'm able to get my clients in quicker
Mhm.
or get their needs met. And lots of times, patients are funny about that. They're not always eager to advocate for themselves, and they sometimes feel that they are bothering the practice. And I always say to my clients, you're not bothering the practice. You've made your surgery date, you've paid good money for this. You need to contact the practice whenever you have a question. They are there for you, and you try not to feel funny about it. But patients do. They just kind of like to step back a little bit, and
Mhm.
that's where I come in and say, no, all right, I'll do it for you.
For you, that's
Yeah,
excellent.
I'll do it for you. But I work with my clients throughout the whole process. So the moment they're considering any type of cosmetic procedures, that's where we start. We start with aesthetic goals. We start with provider referrals. We start with pre and post-op nutrition. We start with the emotional aspect. I mean, it's all a holistic approach, and that's how I like to think of it. And I really wish that if there are any surgeons out there listening to this, that they would start to have more of a mindset that when they're working with their patients, it's not just picking the surgery date, discussing the surgery, but there's so much of a mind-body connection. And also nutrition is huge for recovery. That is really important for a healing process, to really be guided in the nutritional aspect for any surgery, not
Any surgery, yeah.
any
Right.
any surgery.
Any
Yes.
surgery, yeah.
That's really important. And that's an area that's actually lacking in the surgical community, both probably in plastic, cosmetic surgery, and maybe in actually what you do as well, doctor.
Yes.
Yeah.
Thank you. Thank you very much, Michele. That was not only informative, I learned a lot, and you truly have a very, very unique experience. So I would love for you to stay at the top of the hour. So then we will bring and we have a little bit panel and also share last tip with our audience. And with that, thank you so much, Michele.
Thank you.
Love having you. And
Thank you.
I will see you soon. Thank you. And for all audience, that was Michele Garber. Please connect and follow Michele. We love having you to be with us on the Dr. Connect show, and we will be right back. And with that, we have our second special guest, Trisha. Trisha, welcome, welcome, welcome.
Thank you so much. I'm delighted to be here.
Thank you for joining the Dr. Connect. And Trish, I know we just had conversation with Michele, and I want to make sure that we acknowledge 9/11 and how health problem affected everyone. And we do know that overall, a lot of different health issues. It's increased risk of developing different type of cancers, and I'll speak about it a little bit later. And also how do we create our mindset? And I know that I didn't know that Michele was close in the area. So I really want to ask you if it's any relation. I'm not a responder, but I truly just want to acknowledge that this is very important week in our history. And then after that, we dive in our conversation about your story. Trisha, please tell us a full name, where are you located, and a little bit what you do and your story.
Okay, so my name is Patricia Heitz, or my friends and family call me Trish. And I live outside of Albany, New York, in upstate New York. in a little town called Selkirk, New York.
Okay.
And my story is that back in 2002, I was diagnosed with kidney cancer, and
Yes.
I had no symptoms whatsoever, so it was quite shocking. And I felt that I had my children were young at the time, and only 10 months prior to that, my husband's father had died from the same disease.
Oh,
So
so
of course, to hear that diagnosis and know what happened was just devastating, especially when there was no symptoms and there was no warning. I was going to my annual gynecological checkup, and my gynecologist was feeling my abdomen around for, I'm not sure, he was just kind of, examining my abdomen, and he felt something on the right side of my abdomen, and he said to me, "Ooh, what's that?" And I didn't feel anything. I didn't know what he was talking about. He made me touch the area. I didn't really feel anything. But I should have known how important it was, because he said, "No, that's something, and I'm sending you for an MRI tomorrow." And so I went for the MRI, and I didn't tell my husband. I didn't tell my children. I didn't tell anyone, because I thought, oh, why worry anyone? Because I feel fine. So I'm sure it's nothing. And so then he had me come back the following day. And when I sat in his office, and I thought to myself, I was sitting there thinking, I could be doing so many things now. I can't believe I'm wasting my time coming here, because there's nothing wrong with me. And so when he came in the room and he said, "You have a mass on your kidney," I almost fell off the chair. So it turned out to be a very large tumor, about the size of a football, on my right kidney. And I felt the miracle about the whole thing was that after they took the kidney and they biopsied the surrounding tissue and the lymph nodes, they discovered that the kidney had encapsulated, and that right kidney had shut down, and the left kidney took over. So I believe that's what saved my life, because nothing went through that right kidney, and therefore no cancer cells were found in any of the surrounding tissue or the lymph node. However, that was 19 years ago now. They said that
I'm so sorry to hear about it. Yeah, that's a devastating shock. And yes. So how did you, now years pass by, how are you helping now people? This is, you have so much experience in such a story.
So how I'm helping people is that was, as many cancer diagnoses are, a huge wake-up call for me. And you kind of start looking at your life and saying, what am I doing with my life? Am I happy with my life? And I wasn't happy with my life. And so I started reading every mind body wellness book or audio tape or whatever that I could. And I learned so much about
educating yourself.
Yes. What we believe, what we think, what goes on in our head has a direct impact on our physical well-being, which I never knew before. And that was just mind-blowing to me. So I decided that I wanted to learn as much about this as I can. So I started doing that. And then back in 2017, when I had been studying this for, a long time, I decided to take all of the things that I learned, that I had used to make my life better, and my life is so much better now. And I wrote a book, and the book is called Daydreams Come True. And it's not like a regular story about me. It's really about the reader. It's a workbook, and it asks very pointed questions about who they think they are and what they believe. So it forces them to really think the way I had to think. And I wanted someone to have those questions to ask themselves without having a life-threatening disease to force them to think that way. So that book, it asks them very important questions that only they have the answers to, about what they believe and how they can change those beliefs to make their life what they want it to be.
Thank you. Thank you for saying this. And a lot of people listening to you, and also why we trying to connect through this platform, because we also would like to create something bigger and make sure that people get access information who can just, listen like this on TV. So let's say, what advice you can give to people if they live, in a community where limited access to phone, internet, and they just, pick up your book and they read your book, and tell us maybe 3 tips that they could share or strategies they could learn.
Well, I would say the first thing is to question all of your beliefs. If you are not happy with your life, the first question is, why am I not happy? Why don't I have? Why is that? You have the answer. We all have the answer. It's about having courage enough to look in the mirror and say, what is it that I believe about myself that I should change? I think the second thing that I would say is to always, what I did with myself was I walked every day after recuperating from my kidney surgery, and that's when I listened to audio tapes. I believe everyone, we have beliefs that control our behavior and what we think about, and that control our health. And if you don't question those beliefs, this is how you become ill. So every day, I tell all of the people that I work with, all of my clients, is that you have to educate and educate your mind, read something, listen to something, but educate and fill your head with new knowledge about what you want to have happen in your life. Inspire yourself every day. You can't just get up, go to work, and think that your life is going to change. You have to change how you think in order to change your life. So in order to change how you think, you have to put new information into your brain. So I would say that's very important to do that every day.
And that mindset, it's very important. I absolutely agree with you. And I will tell for a fact that they don't teach that in medical school. And in fact, the alternative medicine and all new approaches right now, just now the guidelines start coming in, because for a long period of time, it was absolutely barrier. So that's the whole reason that we would like to create and open a little bit perspective, because also we don't want patients or families or someone come in, let's say, to the appointment and be afraid to share and be afraid to tell that, oh, my mindset changed. That's not a prescription. So we want to tell that, yes, what works for you. So you work on your mindset, you create your own path. And like you said, you might be walking with, music or audiobook, or you may be speaking with a friend, or maybe you take a hike. So whatever it is, right? So we are trying to create mindset. Yes. Excellent, Tricia, excellent. Anything else you would like to share with us?
Just that all of us, I would say probably the most important lesson that I learned throughout this whole experience is to look at our life through the eyes of gratefulness and thankfulness, that not everything is a catastrophe, not everything is a chaos. Every single thing that happens to us, there is a solution. We make everything worse by what we believe, what that means to us. Something bad happens, that means I'm a loser. Oh, that means I'm a bad person. It means nothing. It means nothing until you give it meaning. And all it can mean is that you need to change how you think about something. And once you do, the problem goes away. That's all it means.
Yes, I agree. Sometimes I also call things like this labeling, because we basically label ourselves, and it's very similar that we give that name, and we would like to create the community and also not only inspire, but I would say educate and provide a certain tools. So thank you so much, Tricia, for sharing. And it is a very heavy story. So thank you. I cannot imagine the shock and all embrace and how you had to come with all years. But we also would like to remind audience that you're not alone. And please connect with Tricia, connect with our guest. So then we all embrace and we all understand where our barriers. So if we learn our barriers and we learn our limitations and we learn what we label ourselves, that's the only way that we might be able to move to the next spectrum.
Absolutely. Absolutely.
Thank you. Thank you, Tricia, very much. It's my pleasure to have you a guest. Thank you for being with us. And
My pleasure.
yes, I would like for you to stay just a little bit longer, and we will meet at the top of the hour, and I will see you right very, very soon.
I'll be here.
Thank you, everyone, for joining. And with that, we will be right back. Thank you for staying with us at the Dr. Connect show. Welcome, Marilynn.
Oh, hello.
I'm ready for a drink, so let's do it together.
Yes, definitely. Oh,
Loosen up a little bit. Have some water. What are you drinking?
I'm just drinking pure old mineral water. I love water. I learned to love water. Well, after the cancer, I went through the whole liver ordeal and ended up with a transplant. The doctor stressed over and over again that the best thing anyone can do for themselves is drink 60 ounces of water a day. And that sounded very intimidating, but now I do, and I love it. And my skin is better. It's, it's one of those other benefits that come from a bad thing that you were talking about.
Yeah, thank you for sharing.
Thank you.
Marilynn, I would love to hear your story, and thank you so much for being with us.
Thank you.
And can you please tell us your full name, where you located, and then we would love to hear more about you.
Okay, my name is Marilynn Champion, and I'm now living in the beautiful Blue Ridge Mountains, which is one of the presents that my husband gave to me. He said, if you survive, we're going to go live where you want to live, which was a gift, a real gift, and I'm loving it.
Oh, that's so sweet.
Yes. My story actually begins, my cancer story. Back when I was just out of college and teaching in an inner city school, I was going to change the world and do wonderful things. And I learned very quickly that these poor kids had such a negative self-image, and they had been through traumatic experiences that stunned me. And I knew that what I was teaching in the classroom, the history, the English, economics, that was not going to affect their life. So while teaching, I went into grad school. I focused on educational counseling, and it became, I'm a collector. I've collected antiques and everything else. I decided to collect ancient knowledge and correlate that with modern pop psychology, if you will, about the concept of you are who you think you are not a victim unless you think you're a victim or allow it. And you must learn at some point to make the best decisions for yourself, regardless of what other people think. Now, I'm not going to tell that to a 5-year-old who has to learn how to cross the street, of course. But, many of us go through life with the assumptions of our value based on what other people have told us. So I collected all this knowledge and I integrated it into classroom plans whenever I could. And then I came down with cancer. And the first thing I want to say is do not put anything off for any reason. I knew I had the colon cancer. It was obvious to me, but I was in the midst of a very brutal divorce. I had been in the toxic marriage way too long. My physical reserves, my mental and emotional well-being was jeopardized, but I wanted to put it off till after the divorce, thinking I'll have more time to dwell on myself. Well, it almost cost me my life. And I remember when I just went in, and it seemed within hours, I was in the hospital. I don't even recall how it happened. I was in a daze, but he told me, you'll probably have to have a colostomy. You waited too long. And my thought was right then, my son may have to take care of me now, and I don't want to do that. So I've got to fight this every way I can. And luckily, I had a more positive doctor come in the next day, and he said, no, I think we can do what we need to do. And he said, just don't do anything. You can't work or anything for a while. Use your savings, stay home and heal. And since I always had to do something, I decided what I would do is empty this beautiful old steamer trunk filled with books, lectures, everything from grad school. And I would put it together in such a way that if I did die, somebody could benefit from this if it's in the form of a book. But as I got engrossed in doing this, I realized I was programming myself. I mean, some of my books go back to ancient Greece, the oracles and hidden passages.
Interrupting you. So you collected those books.
Yeah, well, yes. And I decided to take all the best parts and write my own book.
Okay. Okay.
So I wrote the Mind Power Journal. And yeah, that was just the beginning of the title. The subtitle is long and it developed, but I ended up just passing it out to friends. It became very, very popular with some friends that were very important and influential people in my community that were dealing with alcohol addiction. And I remember one man sending me a letter and said, "Thank you so much. This is my head Bible. Whenever I'm tempted," he says, "the first thing I do is call my sponsor. And the second thing I do is open your book and read whatever page it was he told me." And I went on and sort of started a new life. I went into business for myself. And as time went on, I realized I was getting ill. And it turned out somehow along the line, I had picked up a hepatitis C infection. They don't know whether it was from a blood transplant. They never really pinned it down. But at that time, this was 2016 when I had the transplant. At that time, they didn't have any medications as they do now to quell the virus. So, it went on and on and on. And I was very, very ill. And at the end of it, there were really only two people who believed that I would survive, and that was my husband and my son. And it was really amazing because I remember my son and I are very close because I was a single mother by the time he was 3 months in utero. So we started life together. He called me and he said, "How are you feeling?" And I said, "Well, it's not good." I said, "I have to plan with God to get my liver transplant when your PhD is done because I'm not going to interrupt your school." He said, "Mom, I wish you'd had that transplant tomorrow." And I laughed and I said, "Well, I hope God heard that." And we just laughed.
It was just a conversation.
Just a conversation because he always tried to lift me up. Well, I called him at 6:45 the next day and I said, "Wyatt, you're not going to believe this, but I'm getting my transplant tonight." And it was just a conversation. It happened the next night. So I can say, whether it's cancer or liver, whatever, do not believe that you have to die just because maybe 20 years ago you knew somebody who died. Magic is in medicine today. It's not a one-way street. You have to be really connected with your doctor in some way or shape or form. If you don't feel comfortable with that doctor, maybe it's possible to find someone else. But also understand that you can tell yourself to heal. I know every day that I was feeling awful, I told myself I had to heal. And I was very lucky because I had a friend who saw how miserable I was during the cancer, both radiation and chemo. And she brought me her juicer and I tried carrot juice. And I had been losing so much weight because I couldn't eat. So I think everyone with cancer who's going under treatment should have access to carrot juice. It does something wonderful to just give you enough appetite to stomach a little food. So I was able to eat 4 or 5 times a day. Then, it's very important. And also I had access to medical marijuana, which I think every cancer patient should have. Not only does it lessen pain and discomfort, but it just makes it easier to hold on to hope because it seemed easier for me to get rid of any negatives or any worries when I was in the medical marijuana, partly because my stomach wasn't aching all the time. Because when you're in pain, it's harder to be positive. So, yeah. After that, I found out that
Sharing all of it.
it's very important to share. And then later on, I found out that people were still looking for my book, so I've recently republished it. It's at mindpowerjournal.com. It's for $5. I want to give it to the world because all that information, many years of study and collections, it's there. I want people to have it. It's important. Yes.
Thank you. And your journey and experience is so important. And I would like to share with the audience also that for those who don't know, to treat liver cancer and also get any transplant and have things like hepatitis, we all understand that the transplant, it doesn't just come overnight. It's a big process. It's a big committees. It's a multidisciplinary approach. It's a lot of appointments. It's one word, the transplant. If we really break it down, it's a very, very heavy process. So thank you, Marilynn, so much for sharing.
Thank you.
And also, I would like to ask you, can you give us like one maybe tip or story or some specific information from your book, maybe like one example, so then we know a little bit more information.
Okay. One of the thoughts that goes through the book in every way that you find is that your brain does communicate with every cell of your body every moment of every day. The main point about my book that makes it a little different for a lot of people, it's a different experience, is I break everything down into chapters. And at the end of each chapter, there are journal exercises. You will know more about yourself doing this than you might if you just read the book. I tell people, don't just read it, answer the questions. Find out what was it, what was it that hurt you all those years ago that makes you afraid to do this or that, you know?
So you give us specific questions,
yes,
or they
many
have
questions.
Many questions. Okay.
Yes.
Okay. So it's kind of landscape of different questions, questions that I might not be thinking, and you kind of help a person to discover, because sometimes like someone asks me, do you have a question? And I don't really know what you
Exactly.
If you give me a hint, then I have 10 questions. So this is very, very helpful.
Yes.
Thank you. Thank you, Marilynn.
Thank you. I'm glad to share. I'm delighted.
And for all audience, thank you for staying with us on the Doctor Connect. And we are connecting through inspiring stories and providing education and information. And all information discussed on this platform does not substitute a medical care. Guests on this platform sharing own stories, experiences, and conclusions. And we will be right back with you with a panel. Thank you, Marilynn.
Thank you so much.
I will see you in a minute. Well, thank you so much for staying till the end, top of the hour. This is the Dr. Connect show, and we are having a small panel. Thank you so much for joining. I would like to ask, do you have for each other maybe some questions or concerns or something that we might talk to each other?
I had a question for Trish. Was it difficult to begin honest conversations with your doctor? You mentioned the fear, and it was a very shocking thing. How did you begin the dialogue?
Actually, I was just in such shock and so intimidated by the whole process. I didn't really have any honest conversations with him. I just kind of did what I was told to do. You know, he explained what would happen next, and I just listened and tried to wrap my brain around that as much as I could. The honest conversations were really with my family. I think probably one of the hardest things to do, and I'm sure you can relate to this because of your son and so forth, is to go and tell your family that you have a life-threatening disease, knowing how worried and how upsetting that will be for them. I've always been a very strong person, and I knew that I could be strong, but I didn't know how to help them. That was very difficult.
And thank you for asking this question, Marilynn, because we do realize that a lot of patients, they just don't feel comfortable. So we
Yes.
want to ensure we set up good conversation and also have this communication and relation and open. Interesting study came that for vitamins, about 80% of patients do not tell their doctor what vitamins they take or herbs or supplements or things that they do outside medical care. And that's why. And I also would like to ask Michele. Michele, do you feel like them? Because you said that you pick up the phone and you talk to the doctor. So is that something that you agree, or you might have a different experience?
Well, I think, first of all, I tell all my clients that it's imperative that they tell their surgeon everything that they take, all their supplements, because they may take something, and if they don't tell their doctor and they're in surgery and they start bleeding, I mean, there have been cases of deaths because a patient has not told their surgeon the entire truth about their medical health and supplements. And I just think, it doesn't matter. There's no reason. I don't think there's a reason that people should be embarrassed about. It's their doctor. They're supposed to trust their doctor. And if you don't trust your doctor, then it's time to see another doctor. I mean, I'm very clear with my own doctor. I tell my own doctor all the supplements that I'm taking. I question a lot, and I find that, sometimes they look at the supplements and I think they're thinking, oh my God, what is she taking this for? What she really needs is a prescription medicine and not this supplement. And I can kind of see it in their faces. And yet, that's my choice. It's my choice. I think people have to advocate for their health. And they also have to talk to their doctors and be honest about it. I had some experiences recently. My cholesterol is up. So this is just a personal story. And right away, the doctor wants to put me on statin. And I took a step back and I did my own research and I started using some supplements and saw that it helped a little bit. It didn't help as much as the doctor wants. And then I decided, okay, I agreed to starting a statin drug, but I was going to do it on my terms, and I was going to have my body do it very slowly and titrate up. And whether or not my doctor really agrees with it, it's something that's the way that I choose to do the medicine. And because I know my own body, and I think it's really important that, as you said, I think it was someone mentioned, your own body. You can feel what's going on in your own body, right? And so if you're that in tune to your body, and you should be in tune to your body, that you need to do things the way that you feel is best for your body. I will say this is very interesting. There is a genetic test out there. It's called PGX testing. And I recently had it myself, and it's pharmacogenomics, and they actually take your DNA and they analyze the medications against your DNA, so you know what medications are going to be okay for your body and what medications you may need to take differently, or what medications will not be okay. And I think it's fascinating that we've come so far in medicine that we are able to do these type of tests, and that could really actually almost save someone's life. Because what if there's a medication that you've been prescribed, but your body doesn't metabolize it properly, and you're not even getting the effect that the medication is supposed to give your body because you're not metabolizing it. So I look to the future that there's just a lot of things on the horizon in medicine and medical care, but we have to advocate for ourselves. That's really important.
And I hear that also partnership, like you said, we have to communicate, we have to tell. So it's listening and challenge. So we have to create that partnership, and also make sure community understand that, we do to stand up for ourselves. And it's very, very important. Well, thank you very much. Also,
It's been good.
now we are almost approaching top of the hour, and we learned. Thank you for sharing your stories. And now I would like to ask, can each of you please tell one tip within 1 minute or 30 seconds to our audience? And we will start from Marilynn. Marilynn.
Okay. I want to say that, again, there is nothing more important than being honest with yourself, your doctor, and your family. And if you have a husband like I had, be honest about that too. I tried too long and it was a failure. I'm recently remarried it's really interesting because he came into my life just when I needed him during the liver transplant. I think truth is the biggest savior we have.
Yeah,
I really
truth.
do.
Truth. Thank you. Truth, and do not wait, and pay
Yes.
attention to your body.
Yes.
Thank you. Thank you, Marilynn. And Trisha.
My tip, I'm kind of going to tag onto Marilynn's thought about truth, and that is to be brave enough to look at what you need to look at about the truth of what you believe you are, and be brave enough to know and realize that you can have whatever you want. You can have whatever life you want. It's all about changing what you believe about yourself. And we were all born to thrive. And if you're not thriving, it's only because you've developed a belief that is misinformation. It's not true. So learn the truth about who you are, and you will thrive.
Thank you. Truth, believe, and brave. Believe and brave. Thank
Yes.
you.
Courage.
Thank you. And courage. Thank you.
Yeah.
Thank you, Trisha, very much. Michele.
You only have one face and one body. Choose very wisely. Take your time. Do your research. And please don't choose a surgeon based on their Instagram account. There's so many fake before and afters out there. It's just so easy now to Photoshop everything. You can Photoshop. I can take a picture of this video and I can Photoshop everyone's faces in this video. So you need to do your research and take your time. Plastic surgery, cosmetic surgery procedures is not retail therapy. You can return something to the store, but you can't return your face and your body.
Yes, I absolutely love it. You have one body, one face, and you have to do your research. Yes, thank you, Michele. And I absolutely agree right now. Even designing, anything right now, it's so many different tools and gadgets. And really, we kind of have to do our own perspective. I always tell we have to start cold and learn ourselves. Thank you.
Yes. Thank you
very much. Well, with that, I really enjoy having you on our show. And this is the Doctor Connect show. We are connecting through inspiring stories and providing education and information around wellness, health, cancer, and medical technology. And thank you very much for being with us on the Doctor Connect show. Please join and subscribe our YouTube channel and comment so you can also be featured on our show. We are super excited for you to be on this journey with us. And thank you so much for watching and listening. And we are looking forward to seeing you in the next one. And with that, bye-bye.
Thank you.
Thank you so much.
I'm Dr. Ludmila Schaefer, and I level the playing field of knowledge around wellness, medicine, and research to help you to make informed decisions.